I'm Janelle Sears. I'm an occupational therapist here at Murtu Medical Center. Been here for 17 years. I graduated from Washington University in St. Louis and finished my clinicals up in Lincoln at the Madonna Rehab Center, and then came here to Murtu, and I've been very fortunate to have a lot of variety here. So it's been a great experience and looking forward to more years. So I want to start with what occupational therapy is. We get that question a lot. Occupational therapy is a healthcare profession that assists people throughout the lifespan and helps them participate in everyday activities, or what we like to call occupations. So when a patient comes in, again, anywhere from infant to elderly, we take a very holistic assessment of the patient and what they like to do and what they're not able to do right now. And we will use those occupations both as part of the treatment and as an outcome for therapy. So we might have somebody that comes in and they're having pain or stiffness and they're not able to maybe button their shirt, or they can't turn the key in their car, those sorts of things. So those are the things we'll work on improving through the therapy process. It might be through exercise, it might be through teaching them new ways, that kind of thing. So that's kind of an overview of what occupational therapy is. I'm going to talk about the orthopedic side of occupational therapy in our outpatient clinic. We've been fortunate to have a new facility with a lot of space, and we've been able to grow that field a lot for us. We typically in our outpatient clinic focus on the upper extremity injuries and weaknesses. So we might see somebody with muscle weakness, joint stiffness. We do hand therapy, so somebody who's had a tendon repair or a surgical intervention to the upper extremity, we'll work with those clients. With the hand therapy, we do sometimes do splinting, and we actually make our own splints. This is a splint that we made, and we also have some that are prefabricated that work just as well or sometimes better. So we'll assess that and see what the patient needs. We also work with chronic tendon injuries or muscle injuries. So things like, you may have heard of tennis elbow or golfer's elbow. We call it medial lateral epicondylitis. That's a really common diagnosis. Thumb tendonitis or a decurvains tendonitis, we work with things like that. We also see people who have had repetitive strain injuries, whether they're on a computer working for long periods of time, or if they're in a production line and real repetitive work and they end up with some upper extremity injuries. So we'll work with those people as well. We see people after they've had fractures come in with stiffness and just not able to regain what they had before, and so we work on getting them back to what they were doing before. Some of our treatments include an individualized exercise program, so we'll get them moving better, get them stronger so that they can participate in whatever occupation they are engaging in. We also look at their occupation, so if it's a work situation, we will sometimes go into the workplace, or we'll have the patient describe that to us, and if there's something we need to adapt to allow them to be able to participate at work or home, then we can adapt the environment or adapt the actual task that they're doing. We do manual therapies such as A-stem. That's been a new thing we've incorporated, and it's been really successful for us. We've like to put that in our pocket of goodies. So we also do tissue mobilization. We use modalities for pain control, or to assist with the inflammatory process and just to speed that healing so that they can get back to their everyday activities. So our goal with the orthopedic population is really just to restore function for that person, help them get back to work, be able to button a shirt, be able to turn their key, fasten their seat belt, do cooking activities. And overall, we just want them to participate in everyday activities and do that as pain-free as possible.